I'd like to thank the organizers for providing us the opportunity to present our work. Chronic wounds in soft tissues and bones have been documented for many decades and are associated with significant morbidities in patients as well as costly complications. Despite significant progress, successful therapeutic outcomes remains a challenge, partly because the wounds have biofilms in them, and also due to an inability of systemically or locally administered antimicrobials to reach the site of infection. We hypothesized that using low temperature sensitive liposomes or LTSLs, encapsulating antimicrobials and combining them with local HIFU hyperthermia would allow us to achieve on-demand antimicrobial release in the bone tissue. Additionally, based on our previous work, we think that HIFU can enhance tumor blood flow, increase vessel permeability, and reduce the interstitial fluid pressure in the biofilm area, all of which would result in enhanced drug penetration and coverage in the wound that are heated. So for this specific hypothesis, we created ciprofloxacin-loaded LTSLs. Ciprofloxacin is a broad-spectrum antimicrobial that is effective against both gram-positive and gram-negative bacteria. For our specific experiment, we compared free ciprofloxacin and LTSL in the presence and absence of MR-HIFU in a rat model. So briefly, rats were injected with free ciprofloxacin or LTSLs at a dose of 10 mg per kilogram body weight intravenously, and HIFU hyperthermia was performed for 30 minutes to an hour. And post 1 hour, the flank region of the rat muscle tissue that were heated were harvested, and the ciprofloxacin levels in those tissues were determined. As additional secondary goals, we also tried to determine the efficacy of LTSL itself against biofilms, and those were characterized both in vitro and in vivo. So going into our first component, which was the liposome itself, with the traditional active loading method, we could achieve greater than 95% encapsulation efficiency in our liposome with a size range of about 140 to 150 nanometers. When we measured the release of ciprofloxacin from the LTSLs in physiological buffers such as PBS and FPS, release from 37 to 39 degrees C was anywhere from 5 to 30%, and at 40 degrees C or greater than 95% of release was obtained. If we look at our hyperthermia goal, we aimed for a mean target temperature of 40 to 42 degrees C in the rat muscle tissue, and it took us about 30 seconds to a minute to get to the target temperature, and the mean temperature of 40 to 42 degrees C could be maintained consistently over the period of treatment using accurate feedback control. If we look at the spatial distribution of temperature itself in the flank region, it was pretty uniform as indicated by these pixelated temperature maps, suggesting that the sequence selected for thermometry was fairly effective in maintaining a consistent temperature in the heated tissue. Now that we could create antimicrobial loaded LTSLs and it could also heat the muscle tissue, let's look into the drug delivery itself. So as we can see here that when LTSL and MR-HIFU were combined together in the rat muscle tissue, it resulted in about 4-fold greater drug delivery compared to LTSLs itself or free ciprofloxacin. Importantly, the drug deliveries that were attained by the free ciprofloxacin in the presence of heat and in the absence of heat were not different, suggesting that heat had no added value in the delivery of free ciprofloxacin, but was more valuable for releasing drug from LTSLs. We then went ahead and characterized the efficacy of these LTSLs in an in vitro system. Staph aureus is a fairly common pathogens that are seen in wound pathogens, so we established a biofilm using a MBEC device, and then these biofilms were treated with LTSL in the presence and absence of heat. The endpoint goals were to measure the number of bacteria that were surviving post-heat LTSL treatment, and also characterize their killing efficiency using scanning electron microscopy. This is a fairly crowded slide, but the take-home message from this slide is when LTSL and heat is combined together, it causes more death of bacteria relative to LTSL alone, suggesting that heat plus LTSL may be acting in an additive or synergistic manner to kill the bacterial pathogens. We also characterized the treated biofilms with scanning electron microscopy, and what we observed was like untreated control that demonstrated round circular bacteria with a rough extracellular matrix. The LTSL alone treated biofilms also had round circular bacteria with a rough matrix appearance. In contrast, the ones that were treated with LTSL plus heat demonstrated a more smoother matrix, which at times looked liquefied in its consistency, and also the membranes appeared to be little damaged, suggesting that heat plus LTSL may be acting in a synergistic or an additive manner to cause more bacterial death. Finally, we just got started into testing these LTSLs in vivo model. So we have generated these abscess models that can mimic a biofilm-like environment of a wound, and our initial data, which is fairly preliminary in its nature, seems to suggest that the abscess burden seems to decrease with an LTSL HIFU treatment compared to LTSL and control only. We are doing the same study in a larger cohort of animal, both in the abscess as well as in bone wounds, and hopefully when we come next time, we'll have more exciting data to share. So in conclusion, so far we have been successful in creating antimicrobial loaded LTSLs. Studies done in a rat model suggest that adding hyperthermia to LTSL therapy may enhance localized antimicrobial delivery by up to 4-fold, and also the efficacy of LTSL with hyperthermia significantly improved bacterial killing, as indicated by a change in the biofilm matrix appearance and the membrane structure itself. Thank you.
Did you just apply the focused ultrasound the once?
Yes.
Just once?
Single treatment, yeah.
Okay. Any quick questions from the audience?
Okay, thank you.
Great, thank you very much.
Thank you.